We are listening to Speak Up and Stay Alive Patient Safety Radio. I am your hostess, Pat Rulo, bringing you the only nationally syndicated patient safety, patient experience radio program on the planet. Thanks for joining us. And speaking of joining us, today I have a special guest who was also a speaker at the recent Cleveland Clinic's Patient Experience Summit, although we didn't get the chance to meet during the event. Well, he is Dr. Doug Finefrock, an emergency medicine physician and the vice chair of the emergency room and program director of the emergency medicine residency at Hackensack University Medical Center in New Jersey. Dr. Finefrock is the founder of the PatientSET Program, Satisfaction Every Time, designed to improve the patient experience and HCAHPS by online video medical education. There are currently physicians and nurses in 114 hospitals nationwide participating in the PatientSET Program education. Dr. Finefrock is also chair of the National Task Force Patient Satisfaction Education and Evaluation of the Council of EM Residency Directors. And we have a lot to talk about today, so welcome to the show, Doug.
Hey, Pat, thank you. It's great to be here.
My pleasure as well. Well, Doug, we always talk about the patient experience and patient satisfaction on this program, and it's one of the top 3 priorities of hospitals over the next few years. And I mentioned the reason why in your introduction, and that is to improve hospital satisfaction survey results called HCAHPS scores. And even though I've talked about these scores on the program before, let's begin by explaining what these scores are and why they are important to a hospital, and how that is tied to a positive patient experience.
It's been an important initiative for some time, and one of the things that's occurred that's really helped to solidify this in terms of actually measuring these scores is with the Affordable Care Act. Out of that came actually these HCAHPS initiatives. So HCAHPS, for those that may not be familiar, stands for the Hospital Consumer Assessment of Healthcare Providers and Systems. And really what it is, it's become a publicly reportable measurement of the patient experience, so that patients actually that are admitted to the hospital who ultimately are able to be released back will give basically a survey rating their experience of care. And what then occurs is that hospitals are compared amongst each other, and there's a comparison of scores, and actually a part of the reimbursement that hospitals get back through CMS has to do to a degree based upon these scores. So it's important now that these scores are in existence that there's actually a publicly reportable system that allows hospitals to compare themselves, and even more importantly allows the patient to actually go online to hospitalcompare.gov and put in the nearest hospitals and do a comparison ranking themselves.
Right, that's very important to do prior to a hospital visit. And so this is the result of that survey that we get as a patient after a hospital stay?
Correct,
okay.
Correct.
So folks, when you get that survey, fill it out because it does mean something. It does help to improve the patient experience for the patient. It also helps the hospital realize where they might need to tweak things and make differences, and it affects their bottom line as well. So there's a lot of motivating factors surrounding this. Yeah. So now you developed the PatientSET program. Tell us what that is and what is the framework.
Basically what this is recognizing that traditionally physicians and nurses, and to talk about physicians first, not always selected necessarily based upon the communication skills. This could be the people who, were often often the bright kids, not always the most social kids, growing up. Who need a certain standard in terms of achieving certain scores to be able to even get into medical school. By all means, the sort of the dedication and the intellect is a huge part of I think being a successful physician. But really, where we are now and what we've recognized and really been pushing our efforts is to look for more than just that, and really to be able to select someone to become a physician who really embodies the patient experience and really is able to connect with patients. And this has been something that several of us have been trying to focus more on, even having the right person enter the medical field. To some degree, there are people who can do this naturally and some that can't. And what my concern was is I felt like a lot of people needed some help in terms of physicians and even nurses, and the help wasn't always provided, or it wasn't always part of the education they received through medical school and even in practicing. So what I wanted to do is basically provides something that can be done, first of all, that can be done for a lot of people, that can be done online as a medical training platform. And what we started off with is the PatientSET Program, which stands for Patient Satisfaction Every Time. And the program consists of a training element, and it consists of an observation element. The training element is actually video examples of real scenarios that doctors will see and nurses will see. And we essentially, I hired professional actors from New York, where I live, and we basically filmed scenarios that occur every day in the hospital setting and showed where the mistake in not being a good communicator and not being able to connect with patients, we showed common mistakes that are made every day and how those mistakes can impact the patient's care and the overall care and the overall experience. But then we filmed the correct way. And so we basically would show where the mistakes were in the video setting and then film the correct way, and then we have a discussion after that. So we have physicians take these courses. They can take in the comfort of their own home or anywhere because they're online, and they get medical education credit for them. But it's a re-education and a retraining based upon video scenarios to help emphasize this. We do the same thing for nurses. When nurses have the same scenarios that are covered in HCAHPS that are part of our content and curriculum for the nurses. We also have it for those working in healthcare that are techs or, say, answering the phone to sort of recognize that the whole experience has to do with the entire healthcare team. So the program starts off with people taking the courses. After they take the courses, we feel that it's great to get the education and set the expectations, but being able to observe and monitor if there's been a changed behavior is really, really what matters in terms of changing our outcomes. So what we do is we actually figure let's get right in there and let's observe and interact and watch our doctors and nurses interacting with patients. And then we give them feedback on how they can improve based upon the ability to connect, based upon things that are sometimes as simple as walking in, appearing friendly and smiling. I've had conversations with doctors of, based upon their observations that they're not smiling. And that's one of the main things that they need to focus on to come across friendly and be able to make a good connection. So we take those elements of what they're doing and not doing, and we basically are able to show them something objective. And that's how we've been able to change behavior, especially when you talk about physicians. They really want to see some objective measurement. They don't like to talk in generalities. But once you're able to really make it about them and really have them feel accountable about what they're doing and not doing, it changes the context of the conversation. So we're able to engage the physicians and enact some meaningful change. So then after that, what we do is we like to make this a process that continues, because our goal here is to change the culture, and that way we're able to follow up and ensure that physicians and nurses are continuing to practice these behaviors.
Yeah, just to walk into the room and smile at somebody and make eye contact, and then just ask the kind of question that's just an open and friendly question, like, how can I help you? Why are you here, and what can I do for you today? And so many times that just gets bypassed and just they rush in. It would almost be helpful to make a video of the actual doctor as they walk in and play it back to them. They might fall over and say, whoa, didn't realize they look like that.
Yeah, exactly. And that's part of what we like to do. I actually was working with a physician who really wanted to improve. Wonderful physician. And she said to me, if I can only see this, if I can only see an example of someone showing me what I could do, as opposed to just telling me what to do. And so the power of the video and reminding them and having them see the scenarios that they have on a daily basis, I think, is where the power of this program comes. What we want to have happen, we have 2,000 nurses here at our hospital taking this education. We want the nurse to remember, and every time they go to give the medication to the patient, that it's very important to explain this and to have them understand. The role is more than just giving that. Now, certainly there's times when that information is going to need to come either from the physician or pharmacist, but an introductory explanation at minimum should be the case. And so what happens sometimes in medicine, one of the other videos that I don't have my site right now, but as an example, with this being sort of a team approach, one of the things that happens sometimes in medicine when doctors and nurses and techs are so busy is that they then turn to this idea of task. So the tech is going to go in and perform a certain task in EKG. The nurse's task might be to give the medication and go on to their next task. And so I show a video of this where basically it's almost this robotic approach where imagine what it's like from the patient's perspective and the family's perspective if someone just comes in and does their job without explaining and without greeting them and in creating that good bond and first impression. But then we flip it around and we show the way that it should be. The way everyone comes in, they smile, they greet everybody, they explain what they're doing, then the next person comes in and it's almost this seamless team that's working together. It's just such a different experience in providing the exact same task and care. So that's one of the ones that we like to do. And I have some videos I think you have from the website, the drfinefrock.com, and one that kind of explains overall what we're trying to do with this program. But, I think the most important thing really is taking a step back and providing some material to those in healthcare that can simply view this from the perspective of the patient and the perspective of the family. Videos themselves are essentially based upon how would the patient view this? This is what's happening on a daily basis in healthcare settings. We show the video and then we bring it back and we say, like for example, the one that you're referring to with the medication. After asking this question, we then turn to the nurse who's taking this course and say, how will your patient perceive your care? How will they rate you on the survey based upon this? So this is a real thing that patients not only affects their experience, but now they're also rating. So we want to make that connection and get to the point where we can always be seeing things through the eyes of the patients and the eyes of the family. So that's our ultimate goal.
It's an excellent and simple way to do it, I believe. Talking about the patient and the patient's perspective, what can we do as a patient to align the patient perspective with the provider's perspective? So often it feels like it's the patient versus the provider. Can we do anything as a patient?
Definitely, by all means. I think that the majority of people in healthcare really would like to make a difference, and they're really trying really hard and hard workers, and are busy and oftentimes overworked. So I think that the expectation, could be such that you can get the care and you should expect excellent care. But sometimes in things, sometimes I think from the patient's perspective, unfortunately, sometimes I think the patients are going to have to be the ones to ask the question and clearly verbalize when there's something they don't understand. Because what might happen from the other end is that a doctor or nurse might just think that you're understanding something or assume it, and if nothing's said the other way, they may just kind of continue to go about their business. So in this example here, this video, they're clearly asking the questions that ideally the nurse would ask from the beginning. But as a patient, I think, you really should. You should be asking the questions. You should have an organized list of questions that you have, and make sure also that the person that helps you with decisions is there for the conversation. We like to train the docs that at the moment when you're giving the discharge information, and the same thing with the nurses, make sure all the important people are in the room. And if someone's not in the room, let's get them on the phone, get them on speakerphone so they can hear what's being said. Unfortunately, sometimes we talk in medical language, which I think everyone's experienced, and occasionally without even realizing it. So the more people that are there with the patient, for the patient, that are their advocates, I think the better the experience will be in terms of really understanding what needs to be done. So I would definitely recommend having whoever the advocate is, or whoever the person that helps you gather the information there at the time of these discussions. It's just a starting point.
Absolutely. The more sets of eyes and ears, the better off everybody's going to be, providers as well, and to be able to provide that environment that allows the patient to feel comfortable to speak up and that they don't feel like, oh, I'm afraid to say anything. Talking about improving the patient experience in the emergency department, I think that's probably, the ER is a unique environment filled with its own patient safety and patient experience issues, just due to the fast pace and the revolving door of patients. You don't have the luxury, I would imagine, of getting to know them and their uniqueness, and they require a quick diagnosis, and there's probably a high risk of complications and death. So how can a provider be expected to act on all of these things and then also be concerned about patient satisfaction and how they come across?
It's a very high standard, but I can tell you, as the residency director, we're actually, we have 24 medical residents in emergency medicine that are training to become specialists in emergency medicine that I'm the director for. And we will have 36 by next year. So the 12 that just started on July 1st, the first thing I did is I met with them and, just briefly got to know each other a little bit. And I said, okay, the first thing we're going to do is we're going to go down to the emergency department, and we're going to see this through the perspective of the patient. So what I had them do is we went down and we discussed what it's like coming in. I said, okay, imagine you're someone that doesn't necessarily, maybe this is one of the first times you've actually been to the emergency department, the first time in a long time. And regardless of how often they go, I said, just imagine how concerned you are. And you're coming to the emergency department. And this is perhaps one of the only times where you don't get to choose a doctor. You don't know who you're going to get. You don't know necessarily what the specifics are about their training, their skill set, but you're just, hopeful and hopefully trusting in the hospital to provide a great service. So you get there, and you're worried about what you have. And you come in, you may register, and then you're taken to the waiting room. So during the period of the wait, where it basically adds to the anxiety and concern, things are not always explained as well as they could be because you haven't seen that provider yet. And everybody really is there to see the provider, to see the physician, and get the answers. So what I had these young doctors do is essentially sit in our waiting room. And I said, just imagine the way that you came into the hospital worried like that, and now you're in the waiting room, and you're going to sit, and you're going to wait, and you're going to worry, and become more concerned, more anxious. So I had them sit there for a little bit, and then I brought them back to a room. And I said, now after all of that, realize the importance of what you need to do to come in to make a great first impression based upon the fears they have, not knowing who you are, not knowing if what they have is a threat to their life immediately. I said, you have a great responsibility. You have to come in and connect, and ease their fears, ease their concerns, and be able to treat them and have them to even be able to gain your trust. It's definitely a lot to ask for from the physicians, but I want them to understand that from the very beginning. Some of this takes time to build up the skills and to be able to really, really connect and really gain people's trust who you literally just met. So I think the first step for us is just understanding the power in that, the power of that connection and the uniqueness of that environment. And so our goal is to give everyone literally the best experience and try to make everyone feel like they're the most important patient in the whole hospital. And that does take a skill set, and that takes work. And one of the reasons we call this program Satisfaction Every Time is that that's the goal, is to really provide that every time. And that takes a real focus and dedication. So one of the things that we train people to do is that before they go into the room to meet someone, to take a little mental pause, right? And no matter what's been going on for the day, you pause and realize you're about to meet a new person. You should give them your 100%, and come in, be very warm, and greet them with a smile, and really with the goal to make them feel like they're the only person there. And so that's part of the skill, and that's the very first thing we say is to take the pause before you go in. So that's the way that we do it. That's the way that we're training our doctors to do this, and hopefully more and more people can see the results of this.
Oh, I'm sure. And it seems like a tough job, especially in the ER, I would imagine.
It's a powerful thing for someone to come in and really, really trust their health and oftentimes trust their life to a complete stranger.
Right.
And so it's a great responsibility for the doctors. And it's important that we always remember that and not forget, how powerful this is. And so I do think we're making progress, but a lot of work still needs to be done. So over time, I'm hopeful that we can see these improvements, but I still think we have a lot of people that this was not part of their background or education. So, hopefully we'll be able to reach as many people as possible and make a difference that way.
Right. And I think you're doing a great job at that. It'd be great to be able to implement this in med school, so it's not just about the board exams, where you could actually catch folks when they were in their formative years, so to speak.
Yep, absolutely. Yeah. That's the idea.
Yep.
One thing I think I would like to say is that sort of recognizing that this has received a lot of attention and a lot of focus. And even if you look at, as an example, the conference we both just recently spoke at the Cleveland Clinic, I think, I don't know the exact numbers, but the growth that they had in 1 year was pretty remarkable.
Yes.
I think they said, what did they say, 700 or 800 the first year, or last year, and over 2,000 this year.
Yes, it almost doubled, I think.
Yeah, so that's just an indication. This is a very powerful movement. The idea of patient experience, patient-centered care has received a lot of great attention. So I'm hopeful that means we're going to continue to improve. But I think that we have to recognize that this has not always been the case, and there was a time when, completely different than how we're training our doctors, where the doctors were trained to have that front, be serious, be the person to not necessarily show emotions. So I think that in some cases we're actually taking doctors and perhaps nurses that were part of that training model and trying to convert them.
Right.
Trying to, and my experience is that you have just such wonderful people, skilled people, and people that have been able to make those changes. It's not always easy, but I can tell you, we've got people that really started off low in this that are now our top people. Mm-hmm. That just needed a few suggestions and examples and additional training to really let some of their natural skills come out. And so I'm one to believe that you can make some changes. I don't think it's easy. I think there are some people that it is very difficult to change, and sometimes your doctors, or nurse are it's the way they are. That's how their personality is. But I also believe, on the other hand, that even if someone's not so natural in terms of their social skills or communication ability, that I feel as a patient, I'd recognize if someone's just making that effort to connect. And I think that's really what patients want. Is they want to feel as if someone really does care about them, and you get a sense that somebody cares about you. And maybe they're, like I said, they're not the best communicator at heart, but we're trying to have everyone maximize the skills they have, and really trying to make the communication a two-way street so that patients feel comfortable and they understand what's going on.
Well, it's all positive, and that's a good thing. Where can our listeners then learn more about you and what you do?
From the website, which is drfinefrock.com, Dr. Finefrock, F as in Frank, I-N-E, F as in Frank, R-O-C-K.com. Got some of the videos, some of the explanations there.
It's been a pleasure to share you with our listeners today, and the next time you're in Cleveland, we need to get together.
Wonderful, we'll do.
Well, again, Doug, thanks so much, and we look forward to having you back soon.
Thanks so much, Pat. Take care.